I consider myself fortunate for having been offered the opportunity to deliver an oration instituted in the name of an eminent teacher, an avid learner, very good mentor, an excellent organizer, a great healer, and no doubt a fine human being, Professor R. Jothiramalingam. Friends, it would have been my pleasure to have him today, or to, if he could have been in this hall today while the oration is being delivered. But I would like to inform you that Professor Jothiramalingam is indisposed. He is attending his wife, who is critically ill and fighting for life. And on behalf of all the members of IAES, we would like to pray God to give him enough strength at this moment of time. Friends, I have selected the title of this oration as a mark of respect to this great man who has spent over 4 decades of his professional life in teaching the students of surgery and in training young surgeons. Rightly it has been said that we do not grow old. When we stop growing, we become old. That means as long as we are in the quest for acquisition of knowledge and skill, we do not grow old. The moment we do not run after this and say that yes, that's enough, that is the time when we become old. If you like to define maturation, maturation is a process, and a process which takes time. Now let's think of a unripe sour mango on one side and a ripe sweet mango on the other side. That is what is a mature mango, which is most acceptable, and a sour mango may be least acceptable. That's what is maturation is. Now this maturation, as far as learning is concerned, takes time and happens over time. Now when you say what is aging and what is maturation, in fact aging is a natural process which advances till we die. But maturation is a process, at some time or other it may peak and arrest. And this maturation in the life of a learner has a significant role. Now, what the learner needs during the maturation process? Now, our learner needs critical thinking. Now, if he is performing a thyroid surgery, if he finds that the recurrent laryngeal nerve is amongst or in a bunch of metastatic lymph nodes in the central compartment, he has to think and decide how best he can take care of the nerve. Self-awareness, appreciating own strength and weaknesses. Communication skill is a necessity for a learner, and relationship, leadership are essential requisites also for a learner. Now all these requisites what a learner needs, he can have this by his affiliation to professional academic bodies. Now if a surgeon gets affiliated to any of these academic bodies like this or any others, then he will be able to score better in all those areas which are basic necessities of a learner than the surgeons who do not get affiliated to any of these professional academic bodies. Now, when a student completes post-graduation and a license is issued to him to become a surgeon, now What is his aim? Aim is to set a goal. Now what is the goal setting for a surgeon opting to undertake thyroid surgery? Now the goal for such a surgeon is, if he can perform safe and effective thyroid surgery, then he will be able to earn a name. But how can he perform safe and effective thyroid surgery? He can do so by having a clear understanding of the normal neck anatomy and the anatomical variations, and by obtaining an excellent training in the appropriate surgical training or the technique of thyroid surgery. And following training, he needs the boost, the reinforcement, what is known as maturation. That is, he has to pass through a phase of maturation that gives him refinement in the technique of surgery. Now, training and maturation, they come one after another and are linked to each other. Maturation follows training. Now let's think of, there are three different situations. One is a postgraduate student starting to learn thyroid surgery as a resident in a teaching medical institution. Now next, he passes out or he completes his post-grad training, gets a certificate as a surgeon, and then as a general surgeon, he practices thyroid surgery. And third is, some of the established general surgeons, they prefer to specialize in thyroid surgery. So these are the three different situations. Let's see what is the process of maturation that can happen in these three. Now think of a resident who is receiving training during his residential period or residence period. Now what the institute or the department of surgery is expected to do so that he gets good training in thyroid surgery. Now what is required in an institute is, there has to, preferably there should be have a competent endocrine surgeon as a faculty member in the department of general surgery. Number two, now the postgraduate students of surgery should have rotational training in endocrine surgery, so that get exposed to surgeons performing thyroid surgery routinely. And number three is, whether you are a professor of surgery or professor of endocrine surgery, posted in the department or working in the department, one has to ensure that the general surgery trainees, they obtain the requisite skill to perform what is known as safe thyroidectomy. Most can perform thyroidectomy, but what is our emphasis on safe thyroidectomy? Now how you can design this residency program is that during the first year and second year, they can work as second assistant and first assistant, but however, it is necessary that during the third year of the residency period, they should be offered the opportunity to act as primary surgeon for certain thyroid procedures like hemithyroidectomy, and since total thyroidectomy is becoming a routine practice for most of the thyroid diseases, so also total thyroidectomy. So they should have exposure as a primary surgeon for at least these two surgical procedures. Now in addition to these two, they should have adequate exposure also for assisting operations on thyroid cancer, retrosternal or intrathoracic goiters, and Graves' disease. This is a requisite for all of these postgraduate trainings. Now the second group are the surgeons, general surgeons, who practice thyroid surgery or who perform thyroid surgery. Now what can be done to augment their maturation process, who continue or who work as general surgeons either in the medical colleges as teachers of surgery or in rural hospitals, and they want to perform, because the main bulk of the thyroid surgery is being performed by general surgeons. And it is the responsibility of this association, this academic body, to see that these general surgeons get some exposure, some training, some skill updation for performing SF thyroid surgery, which can be possible through workshops, seminars, continuing medical educations or conferences to be organized by Indian Association of Endocrine Surgery or by the super specialty institutes or academic tertiary care academic centers offering MCS degrees in endocrine surgery. They have to have some exposure to look into the operative videos, and there is a need for these members of the Indian Association of Endocrine Surgeons to see that they provide supervision to the general surgeons whenever there is a need. And the general surgeons performing thyroid surgery should be well acquainted or need to know the complications for which we are all worried about: the recurrent laryngeal nerve dysfunction, the hypoparathyroidism, and post-stroke bleeding. And possibly out of these three, possibly the incidence of recurrent laryngeal nerve dysfunction gradually coming down, whereas the incidence of hypoparathyroidism is not so. So there is a need to help them to see that they get necessary skill, they get necessary training, how to take care of the parathyroids, and if they remove accidentally the parathyroids, how the parathyroids can be auto-transplanted. So this is the responsibility of most of the members present in this hall. Now, third group of general surgeons who, after a certain period of practicing general surgery, they opt to specialize in thyroid surgery, as most of the surgeons present in this hall have done that. Because most of us are general surgeons and we opted subsequently to specialize in thyroid surgery. Now, what is required for them is they should have at least a certain, because they are established general surgeons, so they need not have a long 3 years duration exposure to endocrine surgery. They can have a short-term training course in endocrine surgery in some of the institutes where endocrine surgery is being routinely performed, the high volume centers, and training should be imparted to enable them to obtain more experience in performing certain operations like total thyroidectomy, then central and modified neck dissections, and then what is more important, that reoperation of the neck or reoperative neck surgery, because there are situations we are coming across where we have to operate patients who have been operated in other centers. It is seen that surgeons who obtain a training, certain training, and they come back, the complication rate a little higher, possibly maybe depend because of complacency. They think that possibly we are trained now in thyroid surgery, will be able to bring down the complication rate, but instead, because of the complacency, maybe there is slight increase in the complication rate in these surgeons who come out fresh from a short-term training. So that means that is the need for a maturation process which need to be continued. Even if they receive a short-term training, we have to find out means how to bring down complication rate. So either a new surgeon could be paired with a senior colleague who happens to be a member of this academic body, or a endocrine surgeon working in any of these other centers to act as a supervisor role, or we can take the help of the information and communication technology to achieve the desired goal, either using a video conferencing as a maturation tool or mentoring via the video conference, which is known as surgical telementoring, which is becoming more and more popular nowadays. Now this is use of video conference as a maturation tool for surgeons who have received short-term training and gone back to their institutes, so they can any operative workshops being held in any of the super specialty hospitals can be transmitted live to those places, so they can participate in those the workshops and learn by two-way interaction. Not only that, also you can hold continuing medical education programs for surgeons working in district headquarter hospitals, so that the experts in medical college can help them to upgrade their skill and knowledge in thyroid surgery. Now, what is required nowadays, as Medical Council of India is emphasizing, we should more often use case-based learning rather than giving lectures. Now, this is a publication that this is work jointly done by the Sanjay Gandhi Postgraduate Institute of Medical Sciences and SC Medical College, Cuttack. This is a study on use of ICT or telemedicine technology for reinforcement of endocrine surgery training. What was the aim of this study? The aim of this study was, this was published in World Journal of Surgery 2007. The aim of study was to assess the feasibility and impact of telemedicine on the reinforcement of endocrine surgery training at distant places to develop this subspecialty in a developing country such as India. And what was the conclusion? The conclusion is like this, that the study concludes that the concept of training of a group of motivated general surgeons to practice safe endocrine surgery at a remote center via telemedicine aided reinforcement of the training is feasible, and this is particularly true in case of thyroidectomy operations, which constitutes the major workload of endocrine surgery in our country. Then other one is, as I said, is mentoring via video conference, surgical telementoring. This is being used and can be more often used in coming days after the National Medical College Network project is implemented by Ministry of Health and Family Welfare, where all the government medical colleges in the first phase will be connected for knowledge sharing, and subsequently the private medical colleges will be included in the network. Now, this telementoring involves real-time interactive teaching of operative techniques by an expert sitting in a or by an expert working in a super specialty institute or expert center to a student or a training not at the same site, sitting or working in a different site or operating at a remote site. Now, telementoring has been developed to allow a surgeon at a remote site to offer guidance and assistance to less experienced surgeon, so as to reduce the complications associated with surgeon inexperience. So this is another study that was undertaken by Sanjay Gandhi Postgraduate Institute of Medical Sciences jointly with Amrita Institute of Medical Sciences, telementoring in endocrine surgery preliminary Indian experience. And the abstract was, telemedicine is starting to play an important role in the health field in India. In this case report, we describe the successful use of telementoring to remove a parathyroid tumor in a patient with residual hyperparathyroidism after 2 previous unsuccessful attempts in tumor excision. So the purpose of just mentioning this publication is to keep you informed that possibly we are entering into an era where technology will help us for facilitating the process of maturation. To conclude, I would like to say that for an effective learning maturation, we have to improve the surgical training. We will require to encourage additional fellowship training for those interested in specializing in thyroid surgery, provide consultation and supervision for new surgeons by the members of this academic body and also other experts working in the field of thyroid surgery or practicing thyroid surgery. And finally, direct more difficult thyroidectomies to high volume surgeons, particularly those with reoperative thyroid surgery or the patients who come back with recurrences. So thank you so much.